Today's VETgirl podcast is brought to you by the American Heartworm Society, whose mission is to lead the veterinary profession and the public in the understanding of heartworm disease. Every 3 years, the AHS hosts their triannual Heartworm Symposium, a scientific meeting that draws leading experts on heartworm disease, industry leaders, and veterinary practitioners who want their protocols to reflect the latest, greatest information about this serious disease. Go to heartwormsociety.org to learn more and to register for the 2025 symposium, which will be held in Fort Worth, Texas, September 4th through 7th.
Hi, VetGirl here today, and super excited to speak with Dr. Aliya Magee, who is a veterinary cardiologist at one of my favorite vet schools, Louisiana State University. Go Tigers. She's a member of the American Heartworm Society Board of Directors, cardiology section head, and an assistant professor of veterinary cardiology. And Dr. Magee, I just wanted to thank you so much for joining us today.
Thank you. Thank you for inviting me.
Of course. Just so our VetGirl audience knows a little bit more about you, do you mind giving us a little bit of background about who you are, where you trained, and what you do now?
Oh my goodness. All right. So I am originally, I'll start at the very beginning. I'm originally from Jackson, Mississippi. So from there to going to vet school at LSU and then doing my specialty training. So both rotating internship and my cardiology residency were both done at Purdue University. And then I was in private practice for a few years, and then family and life matters happened. That brought me back to Louisiana, which is my heart state. And I've been on faculty here at LSU going on, this is my 10th year now. So the majority of my career, as well as the majority of my upbringing, have been in kind of this heartworm endemic region, which is why once I got invited to and got on the board of the American Heartworm Society. It's something that really resonates with me. And as a cardiologist, on the other side of just having personal pets all my life, and now having personal pets as an adult and as a practitioner, seeing the pets that come in with, complications from heartworm disease. So it's kind of a full circle for me in terms of this particular topic, as well as working with the American Heartworm Society to help make it go away, which would be our goal.
Awesome. Well, I'm on the exact opposite end of the Mississippi. Instead of being in Louisiana, I'm actually in Minnesota. And even we see heartworm disease because we always joke our state bird is the mosquito, but I can't imagine how prevalent it is down in the South in Louisiana. I'm super excited to talk to you today because we're going to talk about feline heartworm disease. And I know the American Heartworm Society, what I'll call the AHS from now on, recently revised their feline heartworm guidelines, making significant updates to the recommendations for heartworm screening in cats, as well as the recommendations for management of heartworm positive cats. And, once in a while, people will ping me and they'll say, hey, this cat died acutely. It was found dead at home. And I always worry about that cat having severe cardiac disease where they had a malignant arrhythmia, or feline heartworm disease, which is often underdiagnosed. And so as veterinarians, we know heartworm disease in cats is a serious issue. After all, even a single adult heartworm in a cat can be fatal. And again, probably one of the leading causes of sudden death when I see cats dying at home. As more and more cats are routinely screened for heartworms, we can hope as a profession to have a better handle on the true incidence of heartworms in cats. However, a question that may linger many practitioners' minds is, okay, I've just diagnosed a cat with heartworm. Knowing that there's no approved adulticide treatment for cats, now what do I do with this patient? And so I'm really excited to talk to you because, so first of all, I always love doing more feline-oriented podcasts, but it's not a topic that we often talk about. So really excited to talk to you about this today. I'm excited to talk to you about HARD, which is HARD, or heartworm-associated respiratory disease. You and I were talking before, we're probably the rare people who like to see dyspnea in cats, right? Most other people don't like to. All right, so let's jump right in. As a quick review, again, I mentioned that AHS recently revised their feline heartworm guidelines and now recommends that cats be routinely screened for heartworms. Just because a lot of people aren't going to read this, do you mind summarizing the new recommendations for heartworm screening in cats?
Absolutely. No, I don't mind. So I would say just overall, there's three big old things that we really want you to know about cats. You've covered one, which would be we think this disease is definitely underdiagnosed. And so as a veterinarian, just knowing, just like in dogs, you screen them yearly. We want that to start in cats so that we're on the proactive side rather than on the reactive side. And that's whether a cat comes in with clinical signs that puts heartworms on your radar, or whether the cat is just coming in for their regular vaccines and they're eating, drinking, pooping, peeing, playing at home. So when you say, well, now I'm going to screen this cat, as a veterinarian, you have to know that a lot of the screening tools that we're going to talk about, if it doesn't come out like absolutely, hit the nail on the head positive, that doesn't mean the cat does not have heartworms. So one would be to understand that the screening tools and the diagnostics that we have right now, for the most part, are not the best, the way that it is to easily or relatively easily diagnose it in dogs. And so keeping your mind open when the results come back as a negative finding. So that's going to be important to understand. So then when you actually go in to do your test, one, we do recommend that every cat have a heated sample antigen test, and that's something that in most cases it is not super expensive, is not very difficult to do. However, it does require you to probably send that sample out to a diagnostic lab. So that would be something that's going to be a little bit different rather than having everything just happen in-house. And so the difference between doing like your regular I pull blood out of the jugular vein and then stick it on my antigen test versus I pull blood out of the jugular vein and send it off to the lab and ask for a heated sample antigen test is to increase, the sensitivity of that test. And so we know that cats are tiny and they don't tend to have the number of heartworms that dogs have. So the amount of antigen that they have could be very, very low. And one of the things that makes antigen tests falsely negative would be, yeah, there's antigen here. There's just not enough concentration for the test to come up positive. So that heated sample is a way to more concentrate it and to denature some of the antigen antibody complexes that might be part of, the false negative finding. And so that's one of the big changes in recommendations is that's a standard test for cats. The second thing is, in addition to doing the antigen testing, and I would say it's not wrong to do an antigen test in-house, right? Because if it just comes up positive, then great, you have your answer. But you standard want to also include that heated sample antigen if your in-house one comes up with no antigen found. The second thing would be to do an antibody test, which is the traditional thing that we have always said would be important. And so you're doing both your antigen heated sample as well as your antibody test in that individual, whether they're clinical or not. And one of the things that has changed is that we're recommending a very specific antibody test that has been found to be more accurate than some of the other ones. From brand to brand, the antibody that some of these tests are looking for might be slightly different. And so we found that the Heska brand, which is an Antec brand, is the one that we are ultimately recommending right now with the new guidelines to be used. And again, that's for right now. You're probably going to have to send that out to Antec. What I don't know is whether that's going to be something we can order, we can have that in-house and have adequate supplies in order to just run that test, in your clinic versus having to send that out. So the results might not be as immediate. For cats that are not symptomatic and are just coming in for a wellness exam and you're doing those tests, I don't think you have to do further testing in those cats. The ones that are coming in because there's some symptoms, so in their history, they're coughing or they're wheezing or they're exercise intolerant, or maybe they have some GI distress or some neurologic sign that isn't explainable by, any other reason. Those are all the types of things that could be caused by heartworms. I mean, your classic asthma cat, all of those things we're thinking heartworms should be on your differential list. For those individuals, you would do those two lab tests plus some kind of imaging. Most people have in-house the ability to do radiographs, and so anything that is having problem breathing, the way that you look at the lungs is to do radiographs. And what you're looking for is, does the heart size and shape look normal? Usually it will if this is a heartworm problem. Are the pulmonary arteries large, distended, and tortuous? That doesn't happen as much in cats as it does in dogs. So if the pulmonary vasculature is relatively normal and the cardiac silhouette is relatively normal and that individual is clinical, that doesn't take heartworms off your differential list. Because in cats, it's more of a pulmonary disease and the respiratory, like inflammatory, parenchymal, and alveolar disease, what you're really looking for is, does it look like there's inflammation in the lungs? And so if you have that bronchointerstitial or that asthma cat kind of lung pattern, that with the clinical signs pushes that differential higher on your list. You also have point of care ultrasound. Do you physically see a heartworm in the pulmonary artery? And of course, you have referring to a specialist like a cardiologist for an echocardiogram where we're doing the same thing. We're looking for signs that the right heart's working harder than it used to, signs that I physically see a heartworm, which would be a definitive way, but also in a cat that has all those clinical signs that I don't see that, the finding would be, I still suspect heartworm disease potentially, but I did not see a heartworm today. And so that's kind of the approach clinically at this point.
Wonderful. Such great information. I think the hard thing is we need to make sure that our entire veterinary team is on board because oftentimes some of our own staff don't have their cats on year-round heartworm preventative, right? And so we need to make sure that our own staff are testing, that we're testing appropriately. Again, I'm in specialty practice and like we hardly ever do heartworm tests, but knowing that, yes, we need to send these tests out to make sure that we're increasing the sensitivity with these heated sample antigen tests are so important. Now, I did want to talk to you about cats in general, knowing that the cat's immune system eliminates most heartworms within 4 to 5 months post-infection. And this is when the worms are at the immature adult stage. And I know you mentioned before, it takes one adult heartworm to result in potentially death in these cats. What are the clinical consequences for the feline patient of worm death at this point? And what can and should be done for these patients in either the short or the long term?
So this is great because heartworm disease in cats is distinctly different in terms of its clinical manifestation than heartworm disease in dogs. And what is cool about cats is cats are different. Cats do whatever they want with their disease, just like they do whatever they want in life. And so with cats and heartworm disease, there's kind of three clinical stages. And the first stage is what you've made reference to, and that's usually about 70, 75 days or whatever post-infection. And that's when those heartworms are going to be juvenile adults or immature adults when they arrive in the pulmonary arteries. At that point, there is a lot of acute vascular and parenchymal inflammation that can happen. The cat's immune system is very, very robust. And so a lot of those worms and a lot of those juveniles do get killed by that immune system at that point. And so you have this reaction that's going on where a lot of them are being killed, but you also have all this inflammation that's happening. And so we know that in the 75 to 90 days kind of post-infection, you also have this interstitial to alveolar disease, and that might be where the cat might become clinical. That's your coughing cat. That might be your cat that's dyspneic to tachypneic, exercise intolerant, but it pants a little bit, but then it's fine. And the owner may or may not bring it in right away until those signs get more severe. And then you have cats that might have a more severe reaction that look like an emergency, they're going to come in. For the cats that make it through that stage, the heartworms then become mature adults. And heartworms are very, very crafty little buggers where they have the ability, once they are mature, to suppress the cat's immune system. And so there might be this phase where, yes, they are heartworm positive, and they have a mature heartworm that's kind of hanging out, and the cat has no clinical signs because their immune system has been suppressed. These are the ones where there might be a resolution of clinical signs. And these are the ones where when I was in vet school and we did anatomic pathology down here in Louisiana, we would find heartworms all the time on that necropsy floor. And that had nothing to do with the history that was given on that patient. And so these are your sudden death cats. These are the cats that had some clinical sign and the sign went away. Everybody's happy. So, they no longer are concerned about them. And so there's some period where, again, they can have a resolution of clinical signs or never have clinical signs. One of the more severe stages will be that third stage, and that's where the heartworm associated respiratory distress, all that kind of stuff comes in. And that's where you have the natural death of some of these mature worms. And when they die, of course, there's going to be a release of a lot of antigen, and there's going to be an antibody, excuse me, and there's going to be an intense inflammatory reaction from the cat. And that's where you can get this thromboembolic response. You have worms that are there that are naturally being broken down. So the embolus could be not a thrombus, but it's the worms, breaking down as they're dying. You have this acute and severe lung injury that can happen. And that's again where a sudden death or a severe respiratory response can happen. And the really concerning part about that is even in surviving cats, a lot of them might still have some permanent pulmonary dysfunction and chronic respiratory disease. And that's again where your asthma cat kind of comes in. And we don't have proof, but we really, really strongly suspect at this point that a lot of cats that are being managed for asthma might truly be victims of heartworm disease.
Thank you so much for that great information. Now, I know we brought this up with the one adult worm causing serious threat to cat health. The other consequence of infection in cats is that worms can survive to the adult stage. Why is it that even small numbers of adult worms pose such a serious threat compared to dogs?
I think a lot of that is because cats are tiny. So when I teach students how to do cardiac auscultation on a dog, you're moving the stethoscope all around the chest, right? Because a dog's heart, let's say, is this big, you have this area, you have this area. A cat's heart in comparison might be this big. Their pulmonary arteries are small. Cats are small. So the size of a heartworm itself, one, is going to cause more of that vascular occlusion than it would with one heartworm in a dog. Versus the other thing is that cats are acutely sensitive to the fact that the heartworm is there, and their immune systems, again, are very, very robust. And so the disease that comes from the reaction to the juvenile worms is uniquely something that cats have rather than something that dogs experience. So that first stage where the juvenile worms arrive and they are adults, but they are young adults, you have this intense inflammation that happens in cats that doesn't happen in dogs. And that's even if there's one or two, because the cat's immune system has killed off some of the other juveniles that may have been there. And then from there, you have, is there aberrant migration? Is there one surviving, mature adult heartworm that then it by itself is causing problems? And again, I think it's a combination of the differences in the immune response that cats have to the different phases of the life cycle, as well as the physical size of the cat and the obstructive component that one heartworm can cause in that individual.
You mentioned it before, cats are not small dogs, or, cats are not similar to dogs at all when it comes to heartworm disease or any disease. So again, can be a huge complicating factor. Now, let's talk about patient assessment. Assume a cat has tested positive for heartworms on an antigen test, meaning it is infected with adult worms. What's the next step in working up this patient? And is there specific imaging that should be considered at this point? I know you talked before about chest radiographs versus an echo. And what factors should be considered in deciding what assessments the patient needs?
It's variable. So, like in dogs, most dogs, when they come up positive, are going to have, no clinical signs. They just come up positive at their exam. So, if you have a cat where it just comes up positive, is eating, drinking, pooping, peeing, playing, this was just a yearly exam, then I think I would approach it the same way as a dog, where that advanced imaging may not be necessary. So, at minimum, I want to do my, database. So CBC, my chemistry, my urinalysis, what's the underlying health status of this individual? And then I also would want to do thoracic radiographs because we know that this is an inflammatory disease in that individual. I don't think doing an ultrasound or needing an echocardiogram would be necessary in an individual in order to say, we know you're heartworm positive, you're asymptomatic. Now this is what we're going to do treatment and monitor wise. The cat that comes in that's symptomatic might need additional things. So if they come up positive, again, I'm going to do the blood work and make sure that they are systemically healthy, or is there something else that I need to be aware of? I might do thoracic radiographs, of course. And then in cats, they don't get pulmonary hypertension as frequently as dogs get pulmonary hypertension secondary to heartworm disease, but it's something that they can get. They don't get cable syndrome as often as dogs, but they can get cable syndrome with just one worm. And so I think a cat that is symptomatic doing more imaging in terms of the heart itself might be reasonable to do. If there's a financial component, it doesn't have to be done, right? If it's not an emergency type presentation. But I think in terms of having as much information as you can have in order to say, do I want to be on the more aggressive side as a veterinarian and as a client, or do I want to be on the more conservative side if the cat is responding well? Those additional tests might be able to help with making those decisions for that individual. So to me, a lot of it just depends on how they present, how it was found, and what their underlying health status is at that time.
Okay, wonderful. Now, I do have to selfishly ask a question. I used to be the director of the blood donor program, and so we would screen cats with an antigen and an antibody. And what do you do if you happen to do a feline antibody test? What do you do for that cat in that scenario? Does it change your treatment versus that positive antigen?
Well, yes, it does. So if it's just the antibody, what that tells you is that cat has been exposed. What it doesn't tell you is whether there's a little heartworm family living in there at that time. So you would have to approach that with that knowledge base. And the same thing, how is this cat doing? Why did I do this test? Was it because it's just part of my routine exam? And if they come up positive there and they come up, let's say, negative on your antigen test, that still doesn't mean they are negative for heartworms. So in that individual, that more advanced screening is definitely recommended. So echocardiogram or point of care, I'm looking to see if I physically see a heartworm. Always, anything that comes up positive, thoracic radiographs are going to be indicated for that individual. For the cat that has the clinical signs, and I say yes to all of those things. So they come up positive for the antibody. I know they have been exposed. They come up negative to heated sample antigen. Let's say we do an echocardiogram. I don't see a heartworm in there, but this is kind of the asthma cat, or it has some other miscellaneous signs that puts that differential higher on my list. I think I would still keep my diagnostic list open, and I'm looking for primary respiratory disease that are not heartworms. It can have lungworms, it can have other things, but I also am keeping heartworm disease high on that differential list. And depending on, the other factors in the case, I might move forward with saying, I strongly suspect this might be a heartworm case, and let's treat it as if it is one.
Great info. Thank you so much. Now, I did want to talk to you about treatment. As we know, there are no approved adulticide medications for cats, and melarsoline, which is used to treat heartworms in dogs, cannot be safely used in cats. This is one of the reasons why I'm such an advocate for heartworm preventative year round in cats, regardless of where you live, because there's no good, safe treatment. So, what alternatives do veterinarians have to medically manage these cats? And what are the goals of medical management?
So the first thing is the goals and the client education. One, your cat, we strongly suspect or we know is heartworm positive. And this is what that means. Our goal is for this cat to outlive these heartworms, right? We know that heartworms in cats can live a few years. And so this is a chronic, this is a long-term problem. This isn't something that we're going to just give, a couple of medications to and it goes away. So we don't want to terrify the owner. We want them to understand that sudden death is a possibility, but we don't focus on sudden death because we can't prevent it, we can't treat that. So, in having the owner to understand they have a serious disease, here's what we're going to do about it. One, that client education. If this cat looks sideways, it could be a symptom or sign of something going wrong with the heartworm disease and some kind of symptom that we need to intervene in. So they need to be more sensitive to things that are not normal or typical for that cat during its day. So any exercise intolerance, if it coughs one time, I want to see it. If it's breathing a little harder than you're used to seeing, I want to see it. If it's, huffing and puffing, any of those things, consider if this is an indoor outdoor cat, it doesn't change my thoughts of whether it has heartworms or not. But if it's an indoor outdoor cat and I know that it has some type of respiratory compromise and could get into a crisis, I definitely don't want that cat to be exposed outside when something like that could happen. So consider making that cat indoor only so you can keep a closer eye on it, as well as if it's compromised, it's going to be a lot safer to not be out in the neighbor's yard having an attack versus in your house where it's going to be more protected from the elements and from other animals, but also you might be able to see it happen as soon as possible. So that would be kind of a lifestyle change. Most cats, you're not going to exercise restrict them like you would a dog. So, they're eating, drinking, pooping, peeing, playing, great. And then medication wise, I know that this is an inflammatory process. So just like in dogs, you want for the cat that's just coughing, it's not an emergency, they don't have to be hospitalized. That's where your anti-inflammatory doses of your glucocorticoids come in. So your 3 to 4 week tapering course of prednisolone. Whether this is a cat who's more clinical and you have an owner that definitely wants to be more aggressive in their management, or this is a cat that's clinical and you have definitively diagnosed this is a heartworm cat, then you can consider, do I also treat for Wolbachia? And that's where doxycycline comes in. I would take the cat's overall condition as well as how confident I am in that diagnosis before I did some of the doxycycline treatment. It just depends on the individual. So if it wasn't clinical, this was just a finding, I'm probably not going to do it. I'm going to stick with the steroids when they're clinical. If this is a cat where I'm looking at a heartworm and they came in because of some clinical signs, I'm going to recommend doxycycline, and you would want to use the liquid rather than the, tablets, or certainly rather than capsules in a cat. And so doxycycline, the dose is going to be different in cats than dogs, but the length of treatment is going to be the same. So you do that 1 month course of 5 mg per kg BID dosing, and you're targeting the Wolbachia because just like in dogs, the Wolbachia can stimulate its own inflammatory response. If you're going to be treating Wolbachia, that's the same situation where you might consider something like Singulair. I cannot pronounce the drug name properly. And so I've told students, well, however you pronounce it as a professional, say it confidently, and that's how it's pronounced. So Montelukast is the drug name, but that is Singulair. And that's a medication where there's pros and we don't know if this truly is helpful. There's not a lot of cons and there's not a lot of big negative effects other than, potentially just a cost and you're giving a cat an additional medication. But in that patient, it's going to block leukotrienes. That's a lot of the inflammation. That's something that's going to happen from the Wolbachia. And that's something that might help to lower that inflammatory response to Wolbachia in a cat that has heartworms and maybe they are not clinical. So can we have some kind of preventive to the reaction that the cat is going to have? And so again, for me, it would be both. If I see a heartworm, if this is a clinical cat, and if this is an owner that wants to be more on the aggressive side, I'm going to do both of those things, the treatment for Wolbachia with the doxycycline, as well as talk about the Singulair in addition to the glucocorticoids.
You know, I'm going to give you a huge shout out. And I can kill the companies who actually make these active ingredients so hard to pronounce. You should hear some of our VETgirl bloopers over the past 12 years of podcasts. There are so many that I hack, like Ehrlichia, different species. So I totally get it. Yes. So when in doubt, so good to know. I always joke no animal should die without the benefit of prednisone and doxycycline, but good to know that Singular, the asthma medication, can be used. And I'm not even going to try to pronounce it. Now,
Yeah, it's terrible.
exactly. Now, you had mentioned doxycycline, and you mentioned that we only use liquid in cats and not the pills. Do you mind mentioning why we do that?
Ooh, that's outside of my wheelhouse, but I know it. So, you know that doxycycline, that's one of the medications, especially when it's dry, and it can get stuck in the esophagus and it can result in esophageal stricture in cats. And it's something that can be very, very severe. And so if you're in a situation where you don't have the liquid, you can use pills, you can use capsules, but you want to follow that with, flush 6 mils of water that you're flushing with a syringe to make sure that that goes down and that they are not going to get stuck in the esophagus and then cause additional systemic problems for them. And so I don't think the liquid is difficult to get. So it's just knowing that and keeping that at the forefront of your mind as a veterinarian for any use of doxycycline in a cat.
Awesome. Thank you for mentioning that. I just want to make sure everybody who listens to these VETgirl podcasts realizes that. I remember one time when I was scripted out doxycycline for myself as an anti-malarial when I was traveling to the continent of Africa. The pharmacist sat down with me for 10 minutes to talk to me about all the side effects of doxycycline, right? And we don't always do that. We dispense these medications so commonly sometimes that, again, we do have to be aware of that severe esophageal stricture or esophagitis that can form. So thank you for bringing that up. All right, last two questions. What do clients need to know about monitoring the heartworm positive cats, and what can they do to help their cats have the best outcome? You talked about prednisolone, you talked about Singular, the asthma medication, you talked about doxycycline, keeping them indoors so they're not spreading it. Anything else that they can do to help improve the outcome?
So I want to mention it's not keeping them indoors, it's not necessarily so they're not spreading it like we do in dogs. So dogs will have the microfilaria, and those microfilaria can be picked up by mosquitoes and then transmitted to, the neighbor's dog. Cats, and I'm glad that that came up, don't generally have microfilaria. They are an unintended
Ah,
accident.
great. Thank you for bringing
And
that up. That's
so,
awesome to know.
and so most of what you're focusing on is that cat as an individual and protecting that cat from the elements, protecting them from being outside, having some kind of respiratory distress, and being out in the elements where you can't see them or they are going to be more vulnerable to other animals. And so mainly you want the main thing the owner can do is be educated and to know my cat has heartworm disease. Yes, this is something scary. This is something I don't want to happen again. A lot of cat households are multi-cat households. I don't want this to happen to my other cat, so I'm going to protect them by putting them on preventative. And then I'm going to watch this cat very closely and I'm going to react if and when I see something that is atypical, specifically and especially with them breathing, I'm going to act on it. Most of us have pets, and I can tell you, my dogs, if they don't eat for a couple days, they're going to have to do a little bit more than that for me to show up at the vet practice, right? If they cough a little bit, they vomit over here, they're going to have to do that a little bit more for me to jump on that and bring them in. This is something where if this cat looks left in any kind of way, if it looks sideways, and that's not what it usually does, and I know that this is a heartworm positive cat, I think it is better to act on it and have them seen because when cats have reactions, they do tend to become severe and can become severe. So it's safer to act on something that you're worried about that's atypical for them rather than to kind of push through it the way we do, as pet owners. We want to not have a situation that heartworm associated respiratory disease. They're going to need to get hospitalized and treated with the same things that I mentioned before, but just injectable with higher doses. And they're going to need oxygen. They're going to need IV fluids. They're going to need to be kept warm. And so anything that happens, again, with that cat, the owner's responsibility is to recognize it and act on it.
Love it. I always love being schooled and learning. So appreciate you telling me that. So that's fantastic. We want to avoid that hard. We want to avoid that poor heartworm positive cat who's running, getting chased by a dog, right?
Exactly.
When they're tachypnic and dyspneic. All right, let's close on an aspirational question. If you could sum up what veterinary practitioners, our patients, and our clients stand to gain by rethinking our approach to feline heartworm diagnosis, prevention, and treatment, what would you do to fix it and answer that? besides getting rid of the disease.
Yeah, let's get rid of it. But it's education, education, education. And I think that's on all levels, from they come in, they have a new kitten, all the way up to I'm the cat lady with 4 cats. I've had them for 50 years. I've had 1 million cats. And now this is a new thing you're talking about with me. Why is this coming up? So having a positive conversation, couching it in, we want to protect this cat from this disease because it is potentially deadly. And it's something that is highly, highly, I think, preventable in cats. Also understanding whether it's inside, whether it's outside, there's no difference in the mosquitoes that are hanging out inside and outside and getting dogs that are hanging out inside and outside in the household that that cat lives in with that exact same dog. So understanding that this is something that is in our community, this is something that is everywhere, and this is something that is not super expensive to prevent on a month-to-month basis. And most of the products that are preventatives also do some ectoparasites and some other things. So you're getting more bang for your buck for that one individual. And so having that cat protected against your ectoparasites, your endoparasites, and your heartworms, which is of all of those things, the one that is the most deadly, would be what we want them to do. And then we want to make sure that every year, just like in dogs, we bring them in for their rabies, we bring them in for all of their other things, and we bring them in to have their heartworm screening. And so that's something that we should also be doing for cats on a regular basis. And the more that we do that, the more we identify, but also the more it becomes a regular thing for that owner to realize where they're testing for this disease. That means this is something that happens and this is something that needs to be prevented. That's why they're testing for it year after year. It is important. And I think that altogether will change the thought process with cats and what we're doing with heartworm disease with them.
Such a great, great informative lecture. I really appreciate it. Again, I appreciate everything that I've learned. Again, reiterates the importance of us uniting as a team, even with our own individual clinics or specialty clinics or, academia, to make sure even our own staff are implementing these preventative measures too, right? Making sure they're
Yes.
on year-round heartworm preventative, keeping them on year-round, because again, we don't have a good treatment option for cats. And again, we can't use melarsoline, so we do need to make sure that we're using that year-round preventative medicine. Really appreciate all that you do. Thank you so much for an amazing educational feline heartworm podcast. And I look forward to talking to you in the future.
Thank you so much for the opportunity. I love, love, love talking to you, and I'll nerd out on any old heartworm topic. So
I love it. Thank
it's
you
so
so much.
important.
Thank you.
Thank you.